Hello, my name is Kathy Sullivan. I am a DNP student at the University of South Alabama in the community mental health specialty. My faculty advisor is Dr. Linda Sue Hammonds. I'm going to present the quality improvement project I've been working on, which is the use of SMART goals to decrease depression among patients with diabetes and depression. The need for this is that depression is the most common psychiatric background for this. Need for this project is that pharmaceutical treatment is not sufficient to treat many of the patients who have comorbid depression and diabetes. There are many treatment options for diabetes and depression, pharmaceutical treatment, but they haven't necessarily been found to completely ameliorate the symptoms. Patients diagnosed with diabetes have a 51% comorbidity with depression. Diabetes increases the risk of depression over the length of the lifespan. Medications for diabetes do not typically ameliorate the symptoms of depression. So, for example, if a patient is started on metformin and they have already a diagnosis of depression, if their blood sugars start to stabilize a bit more or they have a medication change for their diabetes, that doesn't necessarily result in a decrease in their symptoms of depression. Medications for depression do not typically ameliorate the symptoms of diabetes. So, for example, if there is another medication change from a psychiatric perspective and the patient is changed from sertraline to Effexor, if they start to show improvement for their symptoms of depression, that doesn't necessarily result in less problems with the management of their diabetes or their symptoms of diabetes. So we found that a non-pharmacological intervention for diabetes and depression is needed. Completed a review of literature and found that the two non-pharmacological interventions that were the most helpful for patients who had comorbid depression and diabetes are goal setting and increased involvement in social activities and engagement. Those are associated with decrease in depression and other chronic health condition severity, including diabetes. The aim of this project is to decrease depression among patients with diabetes from ages 18 to 85 in a private psychiatry practice using SMART goals. The objectives are participants will create SMART goals at the beginning of the project, and at least 80%, 4 out of 5 participants will achieve one SMART goal by the end of the project. The second objective is that at least 80% of participants with scores of 15 or greater on the PHQ-9 scale will score from 10 to 14 by the end of the 4-week project. And the third objective is that at least 80% of the participants with scores from 10 to 14 on the PHQ-9 scale will score less than 10 by week 4. Methods. So the setting for this project was implemented in a small private psychiatry practice for 4 weeks. The practice has a clinical leader who's the psychiatrist, and there were at the time 3 nurse practitioners who worked under the lead psychiatrist. There's office staff, a scheduler / receptionist, and an office nurse to assist with paperwork and communicating with partners in the community and other disciplines, and also the office manager, and at times the billing person was involved in collecting some of the information, particularly, well, it was limited to the PHQ-9 questionnaire. Participants for this quality improvement project were volunteers from patients ages 18 to 85 who are diagnosed with diabetes and have comorbid depression. So this is a private psychiatry practice, so they're primarily presenting for depression, and as we collect the data, they have a medical problem, including diabetes. Patients were volunteers from existing patients who continue to require frequent visits defined as weekly and to bi-weekly visits for the management of depressive symptoms. Many of the patients had more frequent contact with the office. They showed more of an interest, so we would take note of their participation also by if they made any telephone calls into the office or attempted to initiate any check-ins via telemedicine. The interventions are where the participants were administered PHQ-9 and completed SMART goals at initiating visit and evaluation at follow-up visits. So PHQ-9 is the very commonly known patient health questionnaire that is administered at many practices, including psychiatry, but also primary care. Patients are very familiar with this. It's relatively simple. It's 9 questions, and they select the severity of their symptoms. PHQ-9 depression scores are measured as 0 to 4 minimal, 5 to 9 mild, 10 to 14 moderate, 15 to 19 moderately severe, and 20 to 27 severe. So we were focused on trying to reduce the scores of those that were presenting as moderate and above. The other tool that was used are SMART goals, and those are specific, measurable, achievable, realistic, and time-based. Patients created their SMART goals at the initiating visit. They were based on their own input of what was interesting to them and what they thought would motivate them. So there was a variety of SMART goals that were created. For example, one of the SMART goals that was used was checking blood sugar more frequently to determine if they were feeling unwell, weak, and not so well because their blood sugar was low, or if they were having kind of an off day for their depression. And one of the goals was they would check their blood sugar, before 9 o'clock in the morning prior to eating, using their glucometer that was available to them. And they could do so because they had the manual dexterity, had the ability to read the glucometer results and perform the procedure the way that it's supposed to be performed, so there would be accuracy. And then they would do this every day for the length of the project. And if they missed a day, their goal would be 5 out of 7 days. The results of the project. All the initial participants completed the 4-week project. There were 26 participants. All participants created at least 3 SMART goals. 14 of the 26 participants had PHQ-9 scores greater than 15, which means moderately severe depression, at the initiating visit. All 14 participants who had scores above 15 at an initiating visit had scores below 14 at last follow-up visit. So none of them got worse at the last follow-up visit. 6 of the 14 participants with initial scores greater than 15 at last follow-up visit had scores below 10. So they went from 2 categories down in their depression, from moderately severe or sometimes to severe, all the way down to mild to moderate depression. The remaining 12 participants who had initial scores of 10 to 14 at initiating visit, at the follow-up visit had scores that were below 10. The project was pretty successful. There weren't any dropouts, and the scores were pretty good. They completed everything, and there was a great deal more of social engagement by the patients. They were enthusiastic in participating in the project. And they felt like it was individualized to them, so they were making more frequent contact with the practice, which really helped with adherence as well. This project is an example of a quality improvement project to improve depression using assessment with PHQ-9 and SMART goals. In this project, patients were assisted to create SMART goals as a non-pharmacological intervention. PHQ-9 is an assessment that is used in multiple medical settings that is familiar to many patients. SMART goals are an evidence-based intervention that clinicians can utilize without any special equipment. The aim and goal objectives were met for this quality improvement project. Patient scores on PHQ-9 decreased, and at least one goal was met by 100% of the participants, so they felt successful in completing this brief project. Similar quality improvement projects might be considered for private practices treating patients with the comorbidities of diabetes and depression using non-pharmacological interventions. Thank you so much for listening to the presentation, and here are the references for some of the work that was used to create or design, come up with this quality improvement project. Thank you.